From the Cronkite Studios in downtown Phoenix, this is Cronkite News.
Netanyahu speaks. We have coverage from our Washington, D.C. bureau on the Israeli Prime Minister's address to Congress.
Prison health care reform, a new agreement between the Arizona Civil Liberties Union and prison officials has been reached. We take a look at how the agreement could help Arizona prisoners. And back to school. A Liberian school that was opened in honor of one Valley woman reopens for the first time after the Ebola outbreak hit the region.
Cronkite News starts now.
Good evening and welcome to Cronkite News. I'm Jamie Warren.
And I'm Julia Thatcher. Thanks for joining us. Israeli Prime Minister Benjamin Netanyahu spoke to a joint session of Congress earlier today, a speech that stirred controversy even before he took the podium. Reporter Nihal Krishna has the story and reactions from Arizona lawmakers in our nation's capital today.
Thanks, Julia. Prime Minister Benjamin Netanyahu had a warning for Congress about Iran and its nuclear capabilities.
We must all stand together to stop Iran's march of conquest, subjugation, and terror.
While the speech was warmly received by a joint session of Congress, not everyone wanted to hear the message. 57 members of Congress made a political statement by skipping Netanyahu's speech, including Arizona Congressman Raul Grijalva.
The Pope is going to come and talk, went through the process, respected it. The Prime Minister, in a political move, goes directly to Boehner, so why should I applaud that move and encourage that kind of behavior? That's why I'm not going.
But others from Arizona, both Democrats and Republicans, said they thought it was important to be there.
I think it's important that we always listen to any state leaders that come to visit us, whether it's Benjamin Netanyahu or any other state leader. It is our purview as congressmen to have oversight and overview of international relations the president leads.
Representative Paul Gosar said Netanyahu brings a unique perspective.
I'm here to learn to listen from somebody that's from the area, that's had to look evil in the face, particularly from Iran, and the negotiations that are going on here.
While Netanyahu was delivering his message in Washington, Secretary of State John Kerry was continuing his negotiations with Iran to thwart the country's nuclear development. In Washington, D.C., this is Nihal Krishan, Cronkite News.
Meanwhile, Congress is sending President Barack Obama a bill to fund the Department of Homeland Security through the end of the budget year. The proposal does not overturn the president's immigration policies. The House passed the measure today, and the president is expected to sign it. Without action, funding for the department would have expired Friday at midnight.
Turning now to the Arizona State Legislature, the State House took steps to approve a bill that could allow concealed weapons into some public buildings. HB 2320 proposes requiring public establishments like libraries or museums to either allow permit holders to carry their firearms or establish security guards and metal detectors at the entrances. The Arizona Department of Administration estimates that provision could cost the state between $9 and $17 million annually.
The Arizona House is also set to vote on a bill that could dramatically lower the penalty for driving over the speed limit. HB 2662 would make the maximum penalty for driving up to 10 miles per hour over the speed limit only a $15 ticket. The violation could also not be reported to insurance companies or add marks to your record. That bill goes to vote today.
About a month ago, Cronkite News reported on the outrage from residents in a North Phoenix neighborhood over the approval of a medical marijuana growing facility nearby. But today, there may be some hope for those unhappy neighbors. I spoke with a representative who's pushing a bill that could potentially stop its production.
Move it somewhere else.
They need to just take the facility somewhere else.
Somewhere else other than their neighborhood. That was the concern residents had about a month ago after the city approved a variance allowing a medical marijuana growing operation within 1,000 feet of a residential area.
The city and state ordinance says that these types of facilities cannot be within 1,000 feet of a residential zoning district.
But yesterday, the House approved a bill that would prohibit current and future facilities from being located within the 1,000-foot rule, and even further for churches and schools.
It made sense to put it in the statute just to ensure compliance at the local level.
Sponsor Representative Bob Thorpe says it would prevent a variance like the one in this case from ever happening again, along with making sure proper notification is given to neighbors.
In this situation, all the rules were broken.
Mike McCreary, a business owner nearby who previously voiced his concern about the facility, told Cronkite News Today he supports the bill, stating trying to make decisions contrary to what the ordinance states is a mockery to our legislative process. The city of Phoenix has made clear that they followed all rules and regulations when it came to providing proper notification to neighbors about the facility. A spokesperson told Cronkite News Today the city has no comment about the issue, but is aware of the proposed legislation and, if passed, will modify to the spacing requirements. A Board of Adjustment meeting will be held on Thursday to discuss the issue further.
After months of deliberation, the Arizona Department of Corrections and the Arizona Civil Liberties Union finally reached a written agreement regarding the health care reform in prisons. Cronkite News reporter Maria Thompson explains what these policies could mean for the 34,000 Arizona inmates.
A federal judge finalized the settlement last week, putting in place more than 100 healthcare reform policies. This settlement comes after several complaints about the treatment of Arizona inmates.
The overuse of solitary confinement, and especially for the seriously mentally ill in maximum custody.
This is just one of the many issues that led to several complaints against the DOC claiming unfair treatment for Arizona inmates. Donna Ham first toured the prison in 1981 when she met her husband, who was convicted of a drug-related murder 40 years ago.
I realized that these are all people who are getting out, or 99% of them are getting out. And what are they really going to be like if they're treated like this while they're in prison?
People like Ham continue to be advocates for inmates, especially with chronic mental and health conditions. Her biggest concern is the delay in diagnosing problems and receiving treatment, as well as resorting to solitary confinement for unnecessary reasons.
Nothing in the time that I've spent dealing with these individuals has shown me an actual care or concern for human well-being.
James is the son of an inmate currently in Arizona prison. He asked that we not use his last name to protect his father, who has severe pain from the car crash that put him behind bars. He says his father isn't receiving proper medical treatment. Officials at the DOC were unavailable for an interview. ADC Director Charles Ryan said in a statement released in October that this settlement is positive news because it will continue to provide constitutional health care and structured programming to support successful community reintegration. However, some families are still hesitant in believing that this settlement will solve any problems.
Even with those stipulations changing, I think that this problem runs so deep and there's so many ways around it. If they put pen to paper on one thing, they're just going to find another workaround.
James says that he has continued to reach out to the prison's healthcare provider, Corizon, and has received responses saying that his emails are, quote, burdensome.
It would take a major miracle to really just turn my perception around.
Corizon officials were unavailable for comment at this time. To measure these reforms, ACLU attorneys will be doing periodic inspections with prior notice, but will stop them if the ADC conforms to these policies within 2 years. Live in the Media Center, Maria Thompson, Cronkite News.
A Valley Cancer Research Center is taking over medical research.
They're working hard to beat the disease like no other company has done before.
We take a look at TGen after the break. See how they are breaking new ground in fight against pancreatic cancer.
And how suicide prevention advocates are reacting to the Arizona Department of Health Services plan to help battle suicide in our state.
This winter, we'll take you to the heart of Downton.
You have to take control of your feelings before they take control of you.
Thomas. We'll place you at the scene of the crime.
Trouble seeks you out, doesn't it? Yes.
And we'll fly you to the ends of the earth.
Are you seeing this?
Support the one place that can take you any place.
Hi, I'm Beth McDonald, host of 8's brand new show, Arizona Collectibles. Filming for season 2 is right around the corner. For your chance to be a guest on the show, visit us online at azpbs.org/collectibles.
That's wonderful.
Okay. Make sure to sign up early because spots fill up fast. I look forward to meeting you and seeing your treasures. Until then, thanks for watching. Thursday nights at 7:30 on 8 HD.
News doesn't stop on Friday at 7:30 at night. PBS NewsHour Weekend is kind of a natural next step. The NewsHour's been committed to being available on air or online, and now weekdays or weekends. There's no shortage of news that's out there, but why do people come to us? To give them some context and analysis that they can't find somewhere else.
PBS NewsHour Weekend, only on PBS. Check local listings.
Today marks the end of Will Humble's 6-year term as Director of Department of Health Services for Arizona. Humble was promoted to director under the Jan Brewer administration and has worked with DHS for 23 years before putting in his voluntary resignation last month. Head to Cronkite News Online to read the full story of his time as department head.
Last month, the state released a plan to bring an end to suicide statewide. Cronkite News reporter Anjali Meehan has more on the state's mission to reduce suicide statewide. Anjali?
After the Arizona Department of Health Services reviewed a previous plan from 2010 to 2014, they decided to update it. Regional meetings with community stakeholders were held for about 6 months across the state for feedback on what to incorporate into the new suicide state plan. This year's ultimate goal? To reach that number of 0.
Memories of Robbie run through his mind.
Well, this was the last one that he took out there at the raceway.
Bob Adelson's son, who loved cars, ended his own life about a week after this picture was taken.
We were best friends. We were really close. He was my only child.
In hopes of reducing the number of suicides in Arizona, the state has taken on the issue in its updated 2015 Suicide State Plan.
We want to reduce stigma with this plan and make sure that anybody who is dealing with depression or loneliness or is considering taking their life knows how they can get help, and we do have those resources available in our state.
The plan targets risk groups such as American Indians who endure a higher rate of suicide than the rest of the state.
Many grandparents or traditional elders might say, you know, it's taboo to speak about it.
Debbie Manuel trains Native youth in suicide prevention. After several years in her line of work, she has seen the advantage in talking about it.
I have learned that it's extremely vital to talk about suicide prevention with our young people.
Survivor Waylon Pahona remembers when he thought about the unthinkable.
2007 was a very bad year for me. I ended up hurting my back.
An inability to exercise and a near breakup with his girlfriend at the time left him feeling hopeless.
And from that moment, I felt that I didn't want to be on this earth. And so what I did was I tried to take my life.
And now Waylon speaks professionally across the continent, moving Native audiences with his story.
Ask those questions. Get the conversation going. So then you can then go to the next step, which is to refer them to someone where they can get help.
We all can share and we all can, get some help too, because, I did and it really helped.
Leadership at the Arizona Department of Health Services plans to update the Suicide State Plan every year as opposed to every 5 years, including improving the timeliness of data collection regarding suicide deaths in the state. Live in the Media Center, Anjali Meehan, Cronkite News.
The Banner Health and University of Arizona Health Network merger is now finalized. With this change, 3 hospitals now have new names. They include the University of Arizona Medical Center on U of A's campus. By combining the health centers, Banner now has become the largest private employer in Arizona with more than 37,000 employees.
Cancer is the second leading cause of death in the United States. The Translational Genomics Research Institute in Phoenix is working to change that statistic. Cronkite News reporter Nicole Stein takes us inside the lab.
Our goal at TGen is to do precision medicine.
Dr. Michael Behrens may work in a lab full of test tubes and microscopes, but he's on a mission to make healthcare personal.
Where the individual patient's disease informs how we develop recommendations for treatment options.
One study currently underway at TGen aims to help patients with pancreatic cancer. Pancreatic cancer is the 4th leading cause of cancer-related death, largely because of complications from stroma cells, which surround tumors like a mask, making treatments like chemotherapy ineffective.
The main point of our study is to show that patient tumors that have high level of stroma, it prevents therapeutics to get into the tumor.
TGen is the first research institute to make this connection with pancreatic cancer, and the treatments could have a wider reach.
There are other cancer types that have similar kind of problem, high stroma content.
But TGen research goes well beyond cancer studies. Scientists here work in focus groups ranging from diabetes to rare childhood disorders to even canine health and performance studies, which can help give insight to human memory.
We're really inventing and developing and practicing what we hope will become tomorrow's standard of care, which will be far more individualized.
And Dr. Barron says that focus can help accelerate new treatments from the lab to the patient. In Phoenix, Nicole Stein, Cronkite News.
The Institute hopes to keep furthering this study and move it into a clinical trial phase in the near future.
Coming up on Cronkite News, the Maricopa County Health System now has 2 hospitals to treat Ebola. Find out where they are after the break. And smarter solar power, how ASU and SRP are teaming up to better power your world.
The more you know about history, the more you know about yourself.
Let's turn the page.
I believe that this nation should commit itself.
One small step for man, one giant leap for mankind.
You can almost divide American history before Robinson and after Robinson.
Seeing is believing.
We broke records. We broke barriers.
This is incredible.
Suddenly the big picture makes more sense.
We have unprecedented access.
Now I can trace my ancestors. Now I'm looking into their world. Now I can see where they walked.
Just more than an hour ago, Arizona Superintendent of Public Instruction Diane Douglas announced the Tucson Unified School District has made progress in complying with a controversial law on ethnic studies.
And I just wanted to come out today and commend Superintendent Sanchez. We've been able to work together very well, and the department is pleased with the progress that TUSD has made in our partnership working together. We're not quite there yet. There's still work to be done, but we know that we can continue to work together to ensure that TUSD will be in full compliance with the law.
The Arizona legislature enacted a ban on ethnic studies in 2010. Since that time, the Tucson district has taught what it describes as a culturally relevant curriculum. That includes Latino and African American issues. Violating the ban would mean a 10% reduction in funding for the district.
SRP and ASU have teamed up on a project that will help SRP and its customers maximize the benefit of solar battery systems. Cronkite News reporter Jason Homas went to Tempe to get a first-hand look at the test system the researchers are using.
In the Valley of the Sun, more and more people are relying on solar energy to power their homes. Salt River Project, or SRP, has about 15,000 solar customers. SRP is working with ASU researchers on a project with the hope that, in the future, their solar customers will be able to better utilize the battery technology that stores their energy.
Battery technology is still pretty expensive for a solar customer, but we think in the future, as that technology decreases in price and customers want to help store their energy that's produced during the day, that this might be a viable technology.
The system at ASU consists of an array of solar panels, a bank of lithium-ion batteries, a control system, and a device that simulates SRP's load. While the Phoenix area has abundant sunshine and the potential for significant solar generation, the demand for electricity is highest during the hottest part of the day. Solar generation, however, peaks in the early afternoon, which means that solar customers still rely on the grid during peak demand hours. The researchers are looking for ways to align the solar generation with customers' energy use. Essentially, the battery would shift the solar energy generation later in the day to match the system load peak.
The most important benefit we got from this unit is the battery can supply the load during the peak hour. So in this case, the SRP won't need to buy so much power at the peak load.
Having the ability to have customers be able to store that energy for SRP to use during those peak hours would be extremely helpful to us.
Customers on time of day plans pay more for electricity during peak demand hours, but if the stored solar energy can offset some of that demand, then it's a win-win for everybody. In Tempe, Jason Homas, Cronkite News.
Well, today started out a little foggy in parts of the valley, but things cleared up later on in the day.
Casey Brecker is here with your full forecast.
Yes, things are starting to dry up here in the valley, although we still do have that slight chance of rain. We have a low pressure system that's moving past Phoenix up to Colorado, which is causing that slight chance of rain today. Although, as we move into Phoenix right now, it's pretty chilly, 59 degrees and partially cloudy. So it's starting to cool down here in the area. As we take a look throughout the state, it's also pretty chilly. Up in Flagstaff in the Grand Canyon, it's in the 30s, and down in Tucson, it's at 62 degrees. Although, as we take a look at this later this week, we're seeing sunny skies, and it's going to warm up this week into the 80s, just in time for this first week of spring training, starting just today. As we take a look at our 5-day forecast, you can see tomorrow it's going to be 69 degrees, already starting to warm up. But we still do have that 10% chance of rain and partially cloudy skies. As we move into Thursday, we're seeing temperatures start to move up into the 70s with sunny skies and 0% chance of rain into the weekend. In the 80s over the weekend. And for your Cronkite weather, I'm Casey Brecker.
The Liberian school named after one beloved Arizona woman was briefly closed, featuring an Ebola outbreak. But finally, after 6 months, there's good news for students at the Katie Wagner Cavalry Revival School.
Should I believe in the world, Mama? I think so. Should I give up and hide, or should I stay and fight? Should I believe in the rules, Mama?
What are the consequences?
Can I speak out my mind in these changing times? I don't know what to believe, Mama. Will you march with us? There's a fire inside, there's a storm on the rise. Give me a reason to be, Mama.
Buonasera.
'Cause I need someone to believe.
The world is more complicated than it's ever been.
The NewsHour is always going to take you deeper and take you broader.
And that is worth fighting for.
Night after night, 7 days a week.
I'm Maria Hinojosa. I'm Gwen Eichel. And I'm Judy Woodruff.
On behalf of all of us here, thanks for watching.
Cronkite News is proud to join the Arizona PBS News Block here on 8 HD.
Here's a look at what's coming up tonight on Arizona Horizon and PBS NewsHour.
Coming up after Cronkite News, it's Arizona Horizon. Hear from both sides of the debate over Common Core education standards and curriculum. And we'll look at why the state set a new record for exports last year. That's coming up on Arizona Horizon.
I'm Gwen Eichel. On the next NewsHour, we sit down with the director and producer of a new documentary on college campus rape.
Measles, Ebola, just two of the highly infectious diseases that hospitals around the world have dealt with. Now, 2 hospitals here in Arizona are now set up to handle patients who appear to be infected. And it's all thanks to a government grant.
The grants will pay for protective equipment, things to keep the patients safer.
The Maricopa Integrated Health System Hospital located in Phoenix, as well as the University of Arizona Health Network Hospital in Tucson, are 2 of 55 hospitals in the country to qualify for the government grant. In these photos, you can see Dr. Eric Katz in protective gear going through training on how to treat highly infectious diseases such as Ebola in the event of a possible outbreak.
Training consists of putting on all the protective equipment, taking it off in a way that doesn't contaminate the area around you. If you're trying to do a physical exam on someone, but you have to wear a hood that covers your ears, using a stethoscope is very difficult.
Doctors say Ebola is still very rare here in the United States. However, treatment precautions for Ebola and treatment precautions for other highly infectious diseases are the same. They say in case of a possible outbreak, they are prepared to handle anything.
These patients are very, very sick, so they need a very, very high level of care, but because it's so infectious, you also have to have a very, very high level of infection control. These hospitals will be expected to meet a higher infection control. In fact, they're already practicing, they're doing drills.
The Arizona Department of Health Services says that both the hospitals will act as infectious disease centers of excellence. Both hospitals, as well as the state, will receive funding in order to treat potential Ebola patients.
3 Valley girls were watching their dream of running a school in Liberia come true. That is until the Ebola epidemic hit, which forced the school to close. But now, Cronkite News reporter Brittany Bade has some good news for the girls.
The school was named after beloved anthem teen Katie Wagner, who lost her battle with cancer in 2013. But today, her two friends, Allie and Carly, are thrilled to announce the Katie Wagner Calvary Revival School in Liberia is now back open after 7 months of being closed due to the Ebola outbreak.
The end of August is when they shut down the schools finally because it became too big of a spread.
The story of Katie Wagner and the Katie Wagner Calvary Revival School is full of ups and downs. As the school was being built, Katie was getting sicker.
That day actually it was a harder day, and she wasn't really talking.
The day Katie Wagner found out a school would open in Liberia bearing her name.
I remember she propped out of bed and she put her arms in the air and she's like, trust your crazy ideas.
Just 2 weeks later, the school sign was put up just as Katie lost her battle with cancer.
She got to see it all through.
When the Ebola epidemic hit Monrovia, Liberia, shutting down Katie's school, it looked like another grim turn was just around the corner.
But schools are closed for, I think, another 2 months at least.
But today, Cronkite News caught up with Carly again, who is proud to announce the Katie Wagner School is back open.
School opened finally. It was kind of like the light that we shined onto them was reflecting back to us, and it kind of relit that spark.
Moments of meaning that reflect a beloved memory.
So it's nice to see Katie in those moments. I was like, okay, we can still do this.
Stepping Out for Hope is always accepting donations. If you want to give to this local nonprofit, just head to steppingoutforhope.com.
Well, that does it for Cronkite News tonight.
Thanks for joining us. Good night.
Find top Arizona stories anytime at CronkiteNewsOnline.com.